Now, let us talk about the branches of the division of the trigeminal nerve. Now, the first thing I will draw is the mesencephalic nucleus of the trigeminal nerve, and then I will also draw the principal pontine nucleus, and then I will draw the motor nucleus, and then I will draw the let me use another marker. I will draw the spinal nucleus of the trigeminal nerve. Now, like I said, from this nuclei, we have rootlets that actually form. We have rootlets that actually form the trigeminal ganglion. Now, the trigeminal ganglion gives rise to the ophthalmic division, the maxillary division, and the mandibular division. The motor nucleus of the trigeminal nerve gives rise to fiber that actually goes along with the mandibular division, but it is not part of the trigeminal ganglion, but it goes along the fibers of the mandibular division of the trigeminal ganglion. Now, let us talk about the branches of the ophthalmic division of the trigeminal ganglion. Now, like I said earlier on, the ophthalmic division actually passes through an opening called the superior orbital fissure, and then enters the orbital cavity. But before it passes through this fissure, it gives rise to a branch that is called the tentorial nerve. It gives rise to a branch or a nerve that is called the tentorial nerve. Now, when it enters the orbital cavity, it divides into three branches. The first one is called the frontal nerve. This other one is called the nasociliary nerve. And then this one is called the lacrimal nerve. Now, the frontal nerve is further divided into two. It is divided into two. We have the supraorbital nerve, and then we also have what is called the supratrochlear nerve. So the frontal nerve of the ophthalmic division is divided into two. We have the supratrochlear nerve and the supraorbital nerve. The nasociliary nerve actually passes through what is called the common tendon ring and divides into four branches. The first one is known as the posterior ethmoidal nerve. We have the anterior ethmoidal nerve. We have the long ciliary nerve, and then we also have another one which is called the we call it the infratrochlear nerve. The infratrochlear nerve. So the ophthalmic division consists of the frontal nerve, the nasociliary nerve, and the lacrimal nerve. But before it enters the orbital fissure, it gives rise to a nerve that is called the tentorial nerve. Now, the frontal nerve is divided into the supratrochlear nerve and the supraorbital nerve. The nasociliary nerve passes through the common tendon ring and then divides into four branches. The first one is the posterior ethmoidal nerve. We have the anterior ethmoidal nerve, we have the long ciliary nerve, and then we have the infraorbital nerve.